Hello and welcome. Today we'll be discussing a rare genetic disorder called Loeys-Dietz syndrome, or LES. This condition affects the connective tissue throughout the body, leading to a range of complications, most notably affecting the heart and blood vessels. Loeys-Dietz syndrome is primarily caused by mutations in genes involved in the TGF-beta signaling pathway. This pathway plays a crucial role in the development and maintenance of connective tissue. The most commonly affected genes include BR1, TGFBR2, SMAB2, and TGFB3. These genetic mutations are often inherited in an autosomal dominant pattern, meaning that only one copy of the mutated gene is needed to cause the disorder. However, in some cases, the mutation can arise spontaneously, meaning it's a new mutation not inherited from either parent. At its core, Loeys-Dietz syndrome disrupts the integrity of connective tissue. The TGF-beta signaling pathway normally helps regulate cell growth, differentiation, and the formation of the extracellular matrix, the structural framework surrounding cells. When this pathway is disrupted due to gene mutations, the connective tissue becomes weaker and more prone to dilation and dissection, particularly in the aorta. This can lead to aortic aneurysms, aortic dissections, and other cardiovascular complications. The weakened connective tissue also affects other organ systems, including the skeletal system, skin, and eyes. Loeys-Dietz syndrome is considered a rare disorder. Exact prevalence figures are difficult to determine, but estimates suggest it affects around 1 in 50,000 individuals. Because LDS is relatively newly recognized compared to other connective tissue disorders like Marfan syndrome, it is possible that some individuals' LDS were previously misdiagnosed. LS affects all ethnicities and genders equally. The signs and symptoms of Loeys-Dietz syndrome can vary widely from person to person, even within the same family. Cardiovascular manifestations are often the most serious and include aortic aneurysms, aortic dissections, and arterial tortuosity, or twisting of the arteries. Skeletal features may include scoliosis, chest deformities like pectus excavatum or pectus carinatum, and unusually long fingers and toes, a condition called arachnodactyly. Other common symptoms include hypertelorism, or widely spaced eyes, cleft palate or bifide uvula, translucent skin, and easy bruising. Some individuals may also experience joint hypermobility and an increased risk of hernias. Diagnosing Loeys-Dietz syndrome can be challenging due to the variability in symptoms and overlap with other connective tissue disorders. Diagnosis typically involves a thorough physical examination, a detailed review of the individual's medical and family history, and specialized imaging studies such as echocardiograms, CT scans, and MRIs to assess the aorta and other blood vessels. Genetic testing is often used to confirm the diagnosis by identifying mutations in the known LDS-related genes. Clinical diagnostic criteria have been established to help clinicians differentiate LDS from other similar conditions. Loeys-Dietz syndrome is sometimes classified based on the specific gene mutation involved. For example, individuals with mutations in TGFBR1 or TGFBR2 tend to have more severe aortic complications than those with mutations in SMAD3. Additionally, the specific clinical features present can also be used to sub-classify the syndrome, aiding in tailoring treatment strategies to the individual's needs. The treatment and management of Loeys-Dietz syndrome primarily focuses on preventing life-threatening cardiovascular events, particularly aortic dissection and rupture. Regular monitoring with imaging studies is essential to track the size and growth rate of aortic aneurysms. Medications such as beta blockers or angiotensin receptor blockers (ARBs) are often prescribed to reduce blood pressure and slow the progression of aortic dilation. Elective aortic surgery may be necessary to replace or repair aneurysms before they reach a critical size. Other treatments are tailored to manage specific symptoms, such as orthopedic interventions for scoliosis or cleft palate repair. A multidisciplinary approach involving cardiologists, geneticists, orthopedic surgeons, and other specialists is crucial for optimal care. Currently, there are no proven methods to completely prevent Loeys-Dietz syndrome, as it is a genetic disorder. However, genetic counseling is recommended for individuals with LDS or a family history of the condition. Prenatal testing may be available for couples who are at risk of having a child with LDS. Careful management of blood pressure and avoidance of strenuous activities can help reduce the risk of aortic complications. The prognosis for individuals with Loeys-Dietz syndrome can vary significantly depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and proactive management, including regular monitoring and timely surgical intervention, are crucial for improving outcomes. Recent research is focused on better understanding the molecular mechanisms underlying LDS and developing new therapeutic strategies. Studies are exploring the potential of novel drugs to target the TGF-beta signaling pathway and prevent the progression of aortic disease. Additionally, research is ongoing to identify new genes associated with LDS and refine diagnostic criteria. With ongoing advances in medical knowledge and treatment strategies, the outlook for individuals with Loeys-Dietz syndrome continues to improve.